Range of motion exercises. These exercises are done to preserve flexibility and mobility of the joints on which they are performed. These exercises reduce stiffness and will prevent or at least slow down the freezing of your patient's joints. Before you begin your range of motion exercises, you must identify and greet your patients and explain what you are going to do. Then go wash your hands. As you wash your hands, make sure you remember to follow the hand hygiene protocol, cleaning underneath your fingernails and all the way from the tips of your fingers to your forearms. As you dry, remember, 1 paper towel for 1 wipe. When you return to your patient's room, first, provide for privacy. Then, raise the bed for good body mechanics. Before you begin, you must understand the general instructions. Each exercise should be done once per day. Do each exercise 10 times or move to the point of resistance and hold for 30 seconds. Begin each exercise slowly, doing the exercise a few times only and gradually build up to more. Try to achieve full range of motion by moving until you feel a slight stretch, but don't force a movement. Move only to the point of resistance. Do not force the movement. Keep limbs supported throughout motion. Move slowly, watching the patient's face for response to the range of motion exercise. Not following these instructions thoroughly or rushing the process can result in an unnecessary injury to your patient. The first exercise you will do is with the elbow. You will hold the wrist and place the other hand underneath the elbow. Then bend the arm, flexing it up towards the head and extending it away from the body. The next exercise you will do is wrist rotation. Hold the wrist and rotate the hand in a circular motion. You will go to 4 sides, down, up, and then side to side. Before you start exercising your patient's legs, cover them so that he or she is not exposed. Grasp your patient's leg underneath their ankle. First, flex their leg by bending it towards their chest, and then extend their leg by straightening it out. To abduct and adduct your patient's leg, gently pull the leg away from the midline and push it back towards the midline. Next, you will rotate your patient's leg, twisting the ankle out and in very gently. When you are finished with your range of motion exercises, make sure you lower your patient's bed back. Then, unprovide for privacy. When you are all through, give your patient the call light and practice your hand hygiene. Failure to adequately perform these exercises can lead to unnecessary injuries or contractures. These types of injuries are irreversible and can be seen as neglect or patient abuse in your facility or workplace.